Hello everyone, welcome to SCube TV. My name is Rajni, and today on the show, guys, we have a very special doctor with us. Her name is Dr. Rashmi Pandove. She is a child specialist and also a newborn specialist. Today on the show, we are going to speak with her about the COVID situation that is happening in the country so rampantly. So today on the show, we are going to speak with her about how the COVID and the coronavirus is getting the children's affected and all and more about it. But before, let's welcome her to SCube TV. Hi, Dr. Rashmi. Welcome to SCube TV.
Hi, Rajni. Am I audible?
Yes, you are. Yes, you are.
Yeah.
Welcome to SCube TV.
Yeah. Thank you. Thank you for providing this platform so that I interact with the people and make them more aware about the disease and disease-related myths, especially in children. So, as we all know, we are amidst the worst of global crisis with respect to COVID, and we are the world leaders now in the corona cases as well as mortality. So, plus there's so many myths and doubts and queries which I get day in and day out from the mothers and the parents and my known tools. I am getting phone calls. I'm getting phone calls for beds. I'm getting phone calls for oxygen. It's really bad, and turning
Yeah.
down any request is really very disheartening. But then
Yeah.
we are in the worst of situation ever.
So, Dr. Rashmi, without wasting any time, I would, directly like to ask my first question to you,
Yeah,
which is
yeah,
about how this virus is hitting children. Earlier it was said that only the older people are getting affected, and only the virus is only affecting the older ones. But now,
yeah.
we are getting to see that the virus is also hitting the children below 12 years of age. So, what would you like to
Yes,
say about
yes,
that?
yes. See, the virus hit, this is a mutant strain, and this definitely is probably more virulent and more infectious than was the previous one. So, probably that is why the kids are getting more affected. Secondly, last year we were able to restrain our kids and ourselves to indoors. But
Yeah.
now, because it has been already 1 year into the pandemic, we were all like open for our kids to go into parks or the play schools or the play dates and a little bit of shopping. So that has led to a more spread of infection. This is probably the main reason for kids getting affected. So the mortality, the morbidity, and the hospitalization is still quite low. It's just 1%. The total sickness which requires hospitalization is just about 1%. But because the sheer number of pediatric age group is also very high this time, so that 1% would also be higher. So if it is 100, the 1% would be just one. But if you're dealing with lakhs and lakhs of cases, the percentage automatically will highlight more number of people. So that is how. And no doubt, this time, this is the first time I had to hospitalize kids requiring oxygen, kids with bad CT scans, a newborn, a 15-month-old, a 9-year-old. So no age is exempt, but still, I must say, kids are still doing better than the adult population.
Definitely, definitely. But here also, I would like to know that what are the major signs that that we get to see when a child gets affected with the virus?
See, Rashmi, majority of the kids with the virus are asymptomatic. But
Okay.
the kids who develop symptoms, the most common symptom is fever. Second is throat pain. A running nose is quite low in the list. I mean, it doesn't present as cold or runny nose. It's just 10% of the cases which will have running nose. But yes,
Okay.
kids might have fever, might have loose stools, might have vomiting, pain abdomen, and all these features culminating into COVID only. Kids also have rashes over the body, over the skin, over the feet. It can present like chickenpox also, though these cases are rare. But yes, it can have any kind of presentation. Kids usually present with fever, body aches, red eyes, a throat pain, and a loose motion. These are the five symptoms which are quite often seen.
Which is actually also in the adult case too, I think.
Yeah, that's quite similar. That's quite similar.
Okay.
Yeah.
Okay. And what about the pregnant women? I mean, if a pregnant woman gets affected with the virus, I mean, what should they do?
See, getting affected in pregnant virus would affect in the same degree as it would affect the other people or any non-pregnant female. So there is no specific thing that makes a pregnant woman more susceptible.
Okay.
So the incidence of severity and complication is probably similar to the general population, as is pregnancy. So there's not much of a difference amongst the two.
But doctor, I would like to know from you that it's very hard to ask our kids to not go out, because now it has been the
Yeah,
pandemic.
it's
It's been,
almost 2 years.
yeah, it's too difficult for them to stay in. So what should we do from our end to if they get affected with the virus? So what should we do from our end to to keep them healthy and to keep them safe?
First of all, initially when we started with the pandemic, it was always the adults who brought in the infection in the home, and then
Yeah.
kids got affected. But now it's different because kids are moving around, and they
Mhm.
can be the primary case in the whole household. So
Mhm.
for that, I would always advise never shy away from getting tested. I
Okay.
hear people saying, "Oh, doctor साहब कल नहला दिया था. The child got cold. It was a breezy evening. The child ate too many ice cream, so the child is having fever. Or the child ate outside, so the child is having fever." They give these
Mhm.
kind of reasoning, and I say no. It could be all COVID, and believe me, seeing your child and for me labeling it as COVID and non-COVID is not possible. So we have to go in for the test whenever we
Mhm.
find the symptoms are appearing. This
Mhm.
won't only help your child, will be preemptive, will be able to help take hold of complications earlier. We would also be able to protect the elderly of the household. So
Yeah.
it's worthwhile to test our child timely. People
Mhm.
usually shy away. They just hesitate, which should not be done.
Okay. And is there any kind of food that we should, take, or any kind of
See,
exercise that we should involve, get
see,
our kids?
COVID in general has no predilection for certain kind of foods or certain kind of things like ice cream khane se hua ya thanda khana. No,
Mm-hmm.
it's nothing like that. In general, you have to have a healthy eating, fresh fruits, a lot of antioxidants, a lot of water, a lot of fluid intake, so that the body is
Mm-hmm.
well hydrated. Have a good amount of sleep, and
Mm-hmm.
at the same time follow a daily exercise regime for smaller children's. Kids less than 2 year or 5 year, it's not possible to inculcate an exercise regime, but I advise all the parents to go, like you can have a little play area in the house itself, in your balconies, on your rooftops, or you can just go out when there is not lot many people around, non crowded places in the parks, making the
Mm-hmm.
physical distance and the social distancing things in place, so that we have a good exercise regime as well. You can practice yoga, which can be very well done in indoors also, and that
Yeah.
helps. The breathing exercises really help. So it's
Mm-hmm.
important to have a healthy routine, which I mean.
Now, doctor, coming to the vaccine, the vaccination, and now I think from 2nd or 3rd May, children above 18 year can
Yes.
also get their vaccines. So, would you say it is safe to take?
So, yeah, the vaccine has been well studied in age groups above 18, and it is being really used the world over. And the
Mm-hmm.
vaccine is actually safe. There are certain reports which say there are certain side effects or a minimal side effect
Yeah,
like pain and a little fever at the injection
fever.
site,
Yeah, yeah, yeah.
a little fever, a little pain and the injection site, a little body aches. That is usually so with several vaccinations. So
Mm-hmm.
these are the symptoms which should not prohibit anybody from getting the vaccine. These are just mild side effects. So just
Mm-hmm.
go in. The vaccine is actually safe and it is really protective. I don't think so. We have seen any healthcare worker losing his life because of COVID. Probably they have been duly vaccinated well in time this time.
Mm-hmm.
So this proves the vaccine is effective.
Okay, okay. And like you said, that there were so many myths that people are hearing about, and they are always questioning whether this is right or that is right. So are there any myths that you would like to address right now that you want audiences to not to believe it?
So the number one myth is taking kadas, they don't help.
Okay.
Second myth is Ayurvedic tablets, which are in circulation by many
Mm-hmm.
renowned Ayurvedic practitioners here in the country, the Patanjalis and all. They are
Mm-hmm.
actually not effective. They are totally baseless. Don't go in for that. Just maintain a social distance, maintain a hand hygiene and a proper masking practice to protect
Mm-hmm.
yourself. Rest all are myths. And secondly, yes, if your child is eligible for the vaccination, do go in for that. Rest all is a myth.
And now coming to the now coming to the adults. So if they're getting fever, so let's suppose they're getting fever from more than 2 days. So and also they have got themselves tested, but because of the delay in reports and all these stuffs, because there are number of things that are happening in the countries, we are not having proper beds in the hospitals and so many things, and we are getting delayed in in the reports also. So what should we do at that time, and how do we know that whether we have gotten infected with the virus or not?
See, in this pandemic, in the current scenario, I would advise presume any fever, whichever is happening to you, to be COVID, unless proven otherwise, right?
Okay.
As if I develop a fever today and
Mm-hmm.
I know I'll get a report a couple of days later, that
Mm-hmm.
that doesn't mean that I don't have COVID. So I have to believe that probably I'm dealing with COVID, and keep on. I'll get in touch with my physician or my doctor on telephone. I would start the advices given by him,
Mm-hmm.
and along with
Yeah.
that if I develop any abnormal symptom like a bad cough, a heavy breathing, a breathing difficulty, or I develop a extreme weakness, or I experience a fainting episode, then that is a red flag. It means I have to be in the emergency of some hospital or the other, irrespective of the report being positive or negative. So this
Okay.
RT-PCR is just 65% sensitive, and people might still have the disease even if this test is negative. So, in
Mm-hmm.
case you have a fever and in case you start developing these complications, do rush to your immediate emergency or do contact your doctor, whosoever is treating you for that.
Okay. Okay. Got it. Got it. Now, doctor, coming to, I mean, now speaking about vaccination below 18 years, I mean, it has not come into news, I
Yeah.
mean, until now, but what would you like to tell about that?
See, it will take us a little while before we start vaccinating kids below 18 because this vaccine
Mhm.
has not been studied in this segment as of now. The studies are
Okay.
ongoing in several countries, and probably by the next session, that is 21-22, we might be able to vaccinate the kids also. But as
Mm-hmm.
of now, we should, again, I'll repeat, follow the practices to prevent corona. And
Mm-hmm.
along with that, do check your child's vaccination schedule, check the card if any vaccine is pending or not. Do get the vaccines in time. Don't delay the vaccines just because of the fear of acquiring COVID on visiting healthcare facility. There are many people who don't want to visit any of the healthcare setups because they fear that their child or they themselves would acquire COVID. But believe me,
Mm-hmm.
vaccination is important. So
Mm-hmm.
follow your pediatrician, and most of the doctors and we pediatricians are following safe practices for vaccination. So well baby clinics are usually separate, and the fever clinics are separate these days with all of the doctors. So don't shy from getting the routine vaccinations, and do get the annual flu shot. People might not be getting it till now, but this year I would advise all the kids and all the people should go ahead for the flu shot because kids are still not eligible for the COVID vaccine.
Mm-hmm.
So
Mm-hmm.
what all
But
we can do to protect?
But also, there are so many news and WhatsApp forwards that we get, which says that the vaccine is not effective, or
No, no,
the
no.
vaccine. Yeah, because we are getting so many WhatsApp forwards and messages and so many things, and people are believing in these kind of news that the vaccine is not effective, even though you get yourself vaccines or vaccinated, even then you are getting this virus. So, what would you like to
Yes.
tell about that?
Yes. Though though we all doctors have been vaccinated, and
Mhm.
though many of the people in the population have been vaccinated, but
Yeah.
yes, we still have to follow our practices of the personal protection equipment, like the wearing the mask or the shield or the goggles or the PPE kit when we really directly deal with a sick COVID child,
Mm-hmm.
because the vaccine might prevent complications. The
Mm-hmm.
vaccine is definitely helping prevent death, but it might not protect you from acquiring the virus,
Okay.
and you might still develop a little disease, and you might contribute in spreading the disease.
Mm-hmm.
So masking would still be a must even if you are vaccinated.
Okay. Okay.
Right? But
Oh,
yes, the vaccination is really effective in preventing complications as well as mortality.
and what if you are going through, if you are having fever right now, and if you want to go get yourself vaccinated, would that be okay, or like you should wait until you get,
See, if I am COVID positive, so if I turn COVID positive on first of May,
Mm-hmm.
so I should not get vaccination for at least 2 months of my testing positive. तो फर्स्ट में है तो मतलब फर्स्ट जुलाई के बाद ही I should get the vaccination.
Okay.
So there
Okay.
has to be a wait of 2 months after you
Oh,
get
okay.
positive.
Got it. Which is very, very important. I think that people should know about this fact in
Yes,
particular.
yes,
Yeah. And
yes.
also now, doctor, when, both the parents, let's suppose both the parents get affected, with the virus. So how should they take care of their child?
See, if both the parents are, am I there? Yeah, if both the
Yeah.
parents are affected, the worst thing we do is sending our kids because we
Okay.
are putting the elderly at risk.
Yeah.
And if the child is really small, a less than 5-year-old child, or especially less than 2-year-old, wouldn't be able to stay without the parents, right?
Mm-hmm.
And I would advise the parents wear a proper equipment, wear a mask and a gown, and keep the babies with them rather than sending them to the grandparents.
Okay.
Sending the kids to grandparents won't be a good practice ever. We should
Mm-hmm.
be with our kids, following all the precautions. If it's an elder
Okay.
child, if it's 8 to 10 year or a 12-year child, he can manage himself for a few days. But a smaller child has to be with the mother, especially if it is a newborn. How do you
Mm-hmm.
do? How do you manage a newborn? So this is an important scenario, and I would definitely like to discuss few points about a newborn baby born to a COVID positive female. So if a
Okay.
COVID positive female delivers a newborn, we take all the precautions and we ask the mother to feed the baby. We try to
Mm-hmm.
practice rooming in. Ask the mother to wear the mask, wear the gown, clean her hands, sanitize her hands, and keep the baby with herself, feeding the baby with her own milk. That is actually beneficial because it helps to protect the baby, and breast milk never carries the virus. So there is no risk of giving COVID to the baby via the milk. Second
Mm-hmm.
question, which I am often asked is, and see, newborns are really doing well. Even if the many of the newborns don't even turn out to be positive. We usually do a test at 24 to 48 hours, and we assess the baby also for any kind of symptoms. But we have seen that the babies are usually doing well. They don't fall that sick,
Okay.
uh, other than some exceptional cases. In general, they
Mm-hmm.
are faring well. Second thing I'm getting a calls day in day out is, ma'am, I am feeling. Shall I get the vaccination? Yes, you should get the vaccine. There is enough. Though they are not clear cut policies on this, but yes, the vaccination while feeding is absolutely safe for both mother and the baby, and you
Mm-hmm.
should go ahead for that. Go ahead and for
Oh,
that.
okay. Okay. Doctor, before I let you go, one last question I would like to ask is, if one doesn't want to come to the doctor's office because of their child is sick, so what should they do?
Yes, that is what we are advising these days. So this teleconsults and this video consult option is a really good thing and a blessing for both the healthcare workers as well as the patients, because the
Mm-hmm.
patient is able to sit inside the comfort of his home, as well as we are all safe from the risk of getting exposed and examining a child who probably could be COVID. So we have an
Mm-hmm.
excellent tool of managing the kids on videography. We like I ask the parents to get in touch me on phone. We always guide. Somebody from my team would always be there to guide the patient to know about. We follow those patients to know how they are doing well or not. We tell them certain danger signs. See, there are three categories of the disease: mild, moderate, severe, or you can say mild, severe, and critical. So the
Mm-hmm.
mild ones are the ones who just have fever, which lasts for a few days, and the child otherwise does well, is okay, is eating well, is no breathing problem, not much of a cough, and is responding to crocin and the usual home care treatment we are guiding, right? But
Mm-hmm.
if the child develops a sickness like breathing problem, if the child is unwell, cannot feed, if the child is vomiting, if the child is looking dehydrated, child is looking dull, there are 4 5 red flag signs, which mean yes, you should see your you should rush to the emergency. And in that scenario, we definitely need to admit the moderately sick child and the critically sick child. We triage it appropriately. And for the mildly sick child, we do advise them to monitor the home oxygen saturation. But the home oxygen saturation probe, something like this, is not that well suited for a small child because it's a finger probe and that won't fit well for a smaller baby. So we definitely, I personally take a look of how the mother is recording the saturation. Sometimes the baby's finger is moving and you are trying to see the record of it. It won't give a true reading. The saturation might be okay, the saturation might be 80, 100%, but this might be showing 80 because the child is moving. Secondly, I always advise just don't put it for a few seconds and remove it. This has to be put in place for at least 1 minute. Secondly, if you see, there is a beautiful waveform on this pulse oximeter. You can see this graph. If it's visible, I'm not sure.
Yeah. We can.
So if the baby is moving, this graph gets disturbed. This graph has to be still for the reading to be reliable. ठीक है? अगर किसी का 80 reading है, बच्चा हाथ हिला रहा है, तो that is not actually 80. It could be something else. So there has to be a proper waveform of this pulse oximeter. As you are able to see, it's a uniform thing, right? So this is what I personally like to look into when I take a video consult for such a patient, so that extra chaos or extra panic nahi ho.
So right now at this point, I think all we need to do is take care of ourselves and stay, just stay safe and stay healthy and just stay inside.
Yes. So, we have to follow the lessons.
Please go ahead.
We have to follow the lessons which are being taught to us from the day one of the pandemic, almost a year back. We forgot those a couple of months back, and that is what we are paying the price for. So now is the time again to correct us.
Doctor, any last message for the audiences?
The last message again would be, don't panic. Even if your child is having fever, even if your child is having COVID, get in touch with your regular doctor. Follow his advice. Don't go in for too much medications. Don't go in, like many adults are getting a package of ivermectin, dexamethasone, azithromycin, and a whole potpourri of medicines. Your kid doesn't need any of these. Your baby just needs a paracetamol and a good hydration and monitoring of the signs which your doctor would tell you. Secondly, there is no use of getting a whole battery of tests done for kids every day and again. If at all the fever persists beyond 4th or 5th day, that is the time when we really need to get those blood tests in a COVID positive patient to monitor for complications. It's just because the parents are getting so many medicines and are getting so many tests done, so doesn't mean that a child should also follow suit. Your child doesn't need much of it. Secondly, I often get a call, ma'am, the whole family is positive. My baby is turned positive, or one baby is positive, one is negative. What medication should I give? No medication to a child if he is asymptomatic, even if he might turn out to be positive. There is not much of a role of the vitamins and the minerals and all that stuff we are taking. Good amount of water and crocin and monitoring of the signs is all that is needed in COVID. That is my message. And whosoever are eligible for vaccination, please go in for that as and when your time comes as per the age. And secondly, stay safe, stay indoors and practice all the social distancing norms. And stay safe. Take care.
Thank you so much, Dr. Rashmi. Thank you so much for coming to SCube TV and speaking with us.
Anytime with me. Take care.
Okay. You too. All right, guys, that's it from SCube TV. Keep on watching.